We're back to the Neil Haley Show and also the Media Giant Effect. And I'm excited to welcome to the program Dr. Deborah Matthew of Signature Wellness and also author, speaker, everything. Dr. Deb, thanks for stopping by. And again, this is, February, and it's Heart Awareness Month. So it's a time to talk about specifically how we get our heart to be healthier, because we focus so much on our day-to-day. We talked about January and about weight loss, but now it's talk about heart health, because we don't want a heart attack or stroke to change our life dramatically, because it can happen at any time.
It can. And the good news is that there is so much that we can do in order to stay healthy and diminish our risk for heart disease. But we need to start now, because you don't want to find out after the fact that it was a little bit too late.
All right. So what types of things should we think about? Especially, it's never too late, because people could have heart issues younger too. So it's time to really be healthy. I think that 2023 has to be the year of health, because we want to stay healthy. The more healthy we are, the better our life will be.
Yes. Well, some of the things that we kind of know to do for our heart has to do with our lifestyle habits, right? We know that exercise is good for our heart. And it turns out that really any kind of exercise is good. You don't have to exercise an hour every single day to get some heart health benefits. And it doesn't have to be cardio. Resistance exercise, where we're using weights and building muscle, is really healthy too. Our heart is a muscle. So any kind of exercise is better than no exercise. So lace up your sneakers and get out there, because exercise is good for your heart. Another thing that's actually really important for our heart is what you're eating. And there's been mixed messages that have been super confusing over what is heart healthy and what is not heart healthy. Because, you watch some of these TV shows, the doctors and some of these other health shows. And on Monday, there's going to be a guest that says that you should be vegetarian. And then on Tuesday, there's a guest who says, no, eggs are good for you. And then on Wednesday, it's something different. And it's so confusing. But the one thing that everybody agrees on is that sugar is not good for us, and sugar is not good for our heart health. We focused a lot on fat, but we probably should be focusing more on cutting back on our sugar and the processed starchy carbohydrates, the white stuff, the white bread, the white rice, white potatoes, doing those in moderation. And the story with fat is a little bit more complicated, because it's not that fat is bad for us. The reality is there are some fats that are good for us, and there are some fats that are not good for us. So the deep fried foods, those are still on the naughty list. But the foods that are good for us, the fats that are good for us, are the fat in wild caught fish. That's the omega-3 fats. Extra virgin olive oil is good for us. The healthy kinds of fats in avocados and nuts, those are called monounsaturated fats. All of those are actually really good for us. So in order to have a healthy heart, we want you to get healthy fats in your diet.
And that's very, very important. So it's like there's bad and good fats, and searching them and looking them up is very, very important. And the fact of the matter is, the way we're taught to eat growing up is not ultimately the best way to eat and that's the problem. And what we put in our body, why is it when we're older? Here's a great question. I'm going to kind of, as I summarize so far what you've been talking about before, that maybe people don't understand. The older we get, our digestion changes. Certain foods we know now are not as good for us, we can feel. Why is that? Why can we feel it more? And when we eat stuff that is not really good for us, we know it's not good for us. When we were younger, it didn't affect us at all.
That's a really great question. Well, as we get older, you're right, our digestion changes. In order to digest our food, we have to produce acid in our stomach. So a lot of people know if they have too much acid, but it takes a lot of energy for your body to make that acid to digest your food. And as we get older, we're not as good at it. We don't make as much acid. And so it gets harder to digest our food in our stomach. And then if the food is kind of sitting there longer and not digesting well, it makes it more likely that it's going to go up and cause heartburn and reflux instead of going south the way that it's supposed to go. And your pancreas makes what we call digestive enzymes. So when your food gets out of your stomach and it starts going down into your small intestines, these digestive enzymes chop up the food into little molecules that can be digested and absorbed. And again, as we get older, we don't do as good of a job making these digestive enzymes. So as we get older, our digestion is just not actually as strong as it was when we were young. So sometimes when you're making the wrong food choices, you can pay for it a little bit more.
And then you pay for it in different ways, but it doesn't feel good. And it's like, well, okay, I can give this up now, and then I'll say, oops, I shouldn't have, or I know now. And it's great
Yeah.
because if you can be disciplined enough to say, even though it tastes so good, it's not going to make me feel good, and it's sure as heck not going to make me feel good on the scale or to be healthy as I need to be. So coming up with that diet plan, such an important thing in that process. And why does that help so much in your heart health? Because we're trying to focus today on this topic about heart health. If we're eating more healthy foods, is it going to mean the heart does less work now because you're
Not exactly. What we have been sort of led to believe is that the way that you get heart disease is cholesterol clogs up our blood vessels to our heart, kind of like having gunk in your pipes, so the water doesn't flow in your house. But so we're led to believe that cholesterol is clogging up the pipes, can't get blood flow to your heart, and that's what causes a heart attack. And that's actually not really the entire story. What is happening is there's inflammation in our blood vessels, and it's the inflammation that causes cholesterol to get gunked up. Cholesterol is like spackle. So it's kind of like our body is trying to repair the inflamed lining of our blood vessels. So it's really all about inflammation, and cholesterol is just the side story. So when you eat more sugar, when you're eating more processed foods, when you're not getting enough of the vitamins and minerals that your body needs, what ends up happening is you get more inflamed because sugar drives inflammation. So when you're eating these inflammatory foods and you have more of these inflammatory chemicals floating through your bloodstream, the inside lining of your blood vessels gets inflamed, and that's what starts the ball rolling towards heart disease.
Okay, I got it. So it's just one other thing. What other things should we think about when it
Yeah.
comes?
Okay. Stress is a really
Oh
important
man,
risk
that's the
factor.
one that I had a conversation with another guest, and I'm like, oh my, I just wanted to go and say, oh no, because
Yeah.
this is one I think that so many Americans don't focus on is stress, right? The stress is not something that we talk about or we think about, right? And it's too late because that the way we put stress. So explain stress to me more
Yeah.
because I'm
Okay.
intrigued
And
by the
it's not
topic.
too late. And the good news is there are things that you can do about it. So it's not what happens when we have stress is cortisol levels go up. Cortisol is our stress hormone that helps us cope with stress. But cortisol is part of our sympathetic nervous system, that fight or flight response. And so when we're in that fight or flight response, our heart rate speeds up and it tries to beat harder because it's trying to fuel our body to run away from the saber-toothed tiger that's chasing us. So back in the olden days, that whole response was really helpful to help us save our lives. But nowadays, our stress is more like you're stuck in traffic and you're behind the wheel and you're fuming and you're going to be late. And so we're not like running off those stress hormones. They're just kind of all building up. So when we have too much of this fight or flight going on, it's a stress on our heart. Our heart is having to work harder all the time. And that's one of the ways that it contributes to heart disease. It's a really, really important risk factor that we don't pay enough attention to. But the good news is it's not actually about how much stress you have, because a lot of us have stress. We can't just wave our magic wand and make the stress go away. But what really matters is how you allow the stress to affect you. So if you are somebody who worries about things, if you always jump to thinking about the worst case scenario, if you kind of ruminate and say that same conversation over and over again in your head, like, I can't believe she said that to me. What you're doing is you're taking that stressful situation and you're just making it so much worse. On the other hand, if you can learn to catch yourself thinking like that and decide, no, I'm going to be an optimist, I'm going to be one of those people who sees the glass as half full. If you can change yourself and stop thinking the negative thoughts and think about something positive, you can think about, oh, it's almost the weekend, or it's the sky is beautiful today, or you can always find something to be grateful for. And if you can be a positive thinker, you can still have the same amount of stress, but you actually diminish the harmful effects that stress have on your heart and on the rest of you.
Because it's very interesting when you like I probably have more stress now than when I've worked as a teacher or did certain things where it tremendously affected me because it was not enjoyable for me. I enjoyed parts of it, but it was a lot of stress that was not fun stress. So what you have to do is identify that. So that goes back in the holistic point of view, what you do at your practice and things is you look at the mind, body, and spirit, and you're looking at specifically enough the how do you handle stress? Because what it sounds like to me for heart health is it's how we do it. So, for example, if we have those tantrums or we just go 100 miles an hour and don't know how to stop ourselves from calming down and relaxing. We're constantly worrying, or we're constantly thinking about things instead of just, okay, this just happened. Let's move forward, have a positive outlook, and move on to something else. It's going to really affect us because we
Yeah.
never get the chance. Am I correct?
Yeah, and of course it's easier said than done, right?
Yeah.
But taking a few minutes to do some breathing exercises, go for a walk. I mean, there's lots of things that we can do that we know are stress reducing, and we just need to prioritize those, because I think that most people know that they're supposed to be exercising, and most people know that they're supposed to be eating a healthy diet. But this is just as important. It's kind of like a three-legged stool, but we don't focus on this. In fact, in our society, it's almost frowned upon, right? Like if you're stressed out at work and you decide that you just need to go sit in a chair in the corner and just do some breathing exercises, like people will look at you like you're a slacker, like get back to work, like what the hell are you thinking, right? But it's important.
It's so important. And that's something that I definitely am looking at 2023 to look at each day. And I think another one, and if you have another tip of heart health, these are so great because sometimes people don't think about these things. And stress is one that, yeah, we could do a topic in a show about, and how many people are depressed because of stress, have caused other health issues because of stress, especially our older population. It's becoming more and more of an older population, and they're worrying constantly about their kids. They're worrying constantly even about their grandkids now, and they're worrying about everything. Worry is something that is very hard for people to eliminate because it involves, we in our society look at caring, and if we're not worrying about something, we're not caring about it, which is not true.
Yeah.
And that's a hard thing because we can't control everything. We can, in our mindset, have control, but we can't control it through our body all day, where we're thinking about it constantly instead of saying, I'm going to pass this on, saying, this is what I expected to happen, and move forward to something else. And you really have to train your brain. So that's it. Brain helps your health too, right? The more better mental health you have, which is something in our country, the better your heart will be.
You're correct. Absolutely.
All right. Is there anything else you're thinking about? You've come up with such great ideas about heart
Yeah.
health. Any others?
Another thing that's really important for heart health that most people don't know about is hormones. Hormones are really important. So for men, having a healthy testosterone level is important for the heart. Testosterone helps to keep our muscles strong, and your heart is a muscle. And so men who have low testosterone have greater risks for heart disease. And the things that we talked about, exercise, reducing stress, eating right, getting healthy fats in your diet, those are all helpful to maintain a healthy testosterone level. And for women, when we're premenopausal, we've got lots of estrogen, and estrogen is really protective for our heart. That's why women have a much less risk for heart disease than men do. But once we go through menopause, our estrogen levels drop, and then the risk for women goes up just as much as the risk for men. And women are, that's the number one cause of death for women. We think of heart attacks more in men. As women, we spend more time worrying about breast cancer, but the reality is many more of us are going to die from heart disease than from breast cancer. And estrogen is very protective of our heart. So for women who are going through menopause, at least talking to your doctor about the possibility of hormone replacement therapy can be something worth doing, because there are a lot of benefits of hormones, and the risks have been sort of exaggerated and outweighed. And now we really understand better how to use hormones in a safe and effective way in order to get the benefits.
Invest in your health. That's all I have to say, is invest in your health. If you're not investing in your health, if you're not spending your time, because ultimately this is the thing, Dr. Deb, that people don't understand, that they need to start. You're gonna live longer because of technology. Do you want to be in a nursing home? Do you want to be in assisted living where you're basically are away from the world, or you're going to start to work on your health today? Because yeah, you can live to 105, but you could be living a not very fun life to 105 or 120 or 130, or you can choose now to make changes today. And that's one thing in my life I'm looking more and more every day to do, because it's interesting. One thing I'll bring up that I know that you might have wanted to bring up was sleep. Sleep's another thing. If you're not getting enough sleep, that's going to be bad for the heart as well. Can you explain a little bit more on that? I heard that in another thing, and I said, okay, I'm going back to 8 hours. It's so hard to say I'm going to sleep 8 hours, but it's so important for your body to rest that way.
Yeah, well, sleep helps in a lot of different ways. So one way is when you're in a nice, deep, sound sleep, that's when you're making these hormones that are so important to keep your heart healthy. Another is if you have sleep apnea, if you snore and you stop breathing for a few seconds at a time while you're asleep, that is really, really hard on your heart because now you're not oxygenating well, you're not getting the air in, and your heart has to work extra hard. So sleep apnea and not sleeping soundly at night is a really big risk factor. And if you're not sleeping at night, it pushes you more towards diabetes. It causes problems with your blood sugar metabolism. And we're saying that sugar is inflammatory. And if you don't handle sugar well, then you become more inflamed. And of course, people with diabetes have a much greater increased risk for heart disease. But even if you don't have diabetes, if you're not managing blood sugar in a healthy way, partly because you're not sleeping, that increases your risk for heart disease.
Functional medicine will help, right? And there you have it's very easy to find information on you have two places. One, you can purchase your books and learn more about you, but also your practice. So go ahead and tell us two places people can find you.
Sure. So we're in Charlotte, North Carolina, and the practice is at signaturewellness.org. And there's lots of information on the website. But I think it's really important for people to know that you can't just go to your doctor and expect your doctor is going to give you a pill that's going to fix you. Because if we had a pill, we wouldn't have so many people struggling with heart disease and chronic illness. We don't have the pill that's going to fix you. But there is so much that each of us can do in order to take control of our own health and keep ourselves well. And working with a practitioner who can really dig and understand, are you getting the right nutrients in your diet? What's going on with your hormones? Really dig deep, kind of like a 12-point inspection when you take your car in, and you think that's what you're getting when you go in for your regular checkup, but really they're looking for diseases that you already have. I really believe that living well is the best medicine.
Definitely. And then your website also, just to find info on you, is drdebmatthew.com. Is that correct?
drdebmd.com.
All right, perfect. Thanks again, Dr. Deb. Appreciate it. All right,
Thank
you're
you.
listening and watching The Neil Haley Show, and we'll be back in just a moment.